Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us this morning is Nancy King. Thank you so much for calling in today, Nancy.
You're welcome. Thank you for having me.
Yes, of course. We're delighted to have you. We are talking about cancer care with people delaying care due to COVID-19. How important is it, Nancy, to get in to visit your provider if you're having any symptoms at all?
Thank you for asking such a really important and relevant question right now. We are now a year into this pandemic, and we are very, very concerned about the number of people that we are learning who are delaying their cancer care. As we all have known, detecting cancer early and becoming very aggressive with our treatment options is paramount to beating this disease. Even during COVID-19, cancer care should rarely, if ever, be delayed. So we're encouraging our patients to get back to their primary care providers, start looking into diagnostics and options, and making sure that they are taking care of their overall health as well as addressing any concerns that they may have related to cancer.
Sure. So what's McLaren doing to make sure that patients safely get treatment?
At McLaren and Karmanos, we have implemented safe care measures early on in the pandemic. We are limiting, especially in our cancer centers, to just our patients coming in. We are screening our patients and our staff for possible exposures and symptoms when they arrive immediately at our facility. We are providing masks to not only our patients, but our staff are also wearing appropriately assigned masks and protective equipment. We are consistently cleaning all of our surfaces that come in contact with our patients. Our blood pressure machines, thermometers, things that you might take for granted. The treatment tables or couches or chairs where our patients receive their treatment are wiped down before the patient is placed on them or in them, and also immediately afterwards. Of course, we're washing and sanitizing our hands between patients, and we encourage our patients to also wash their hands and keeping surfaces at home. We're doing a lot of education on how they can stay safe when they're not in clinic. And we're also, as a corporation, are so proud of the fact that we have gotten over 80,000 vaccines into arms of not only our staff, but our at-risk patients. And cancer patients are considered high risk. So we're very proud as McLaren and the corporation for being able to get that vaccine out there so efficiently.
Oh, that's great news right here in our community. We'd love to hear that, Nancy. Tell us, what symptoms should we be looking out for?
Oh, cancer can cause a large variety of symptoms, anywhere from a lump that you've noticed on your body, changes in your skin, bladder, or bowel habits, any sort of bleeding or bruising that cannot be explained from a simple little injury in your home, a consistent cough. A lot of people think, oh, it's just allergies. Sometimes you need to look into that. It can be issues with lungs, issues with your throat, sudden weight gain or loss, and the list can go on and on. So it's very, very important for you to touch base, especially after this year we've experienced with the pandemic, with your primary care provider, and have an overall health assessment.
You know, Nancy, we hear a lot about Karmanos. Why is it? What's the benefit to going to a cancer institute like Karmanos?
Oh, great question. We have 16 locations throughout the state of Michigan, and we are also only one of 51 KCI designated cancer centers in America, and that's a huge accreditation and something we're very proud of. Karmanos is the largest provider of cancer care and research in our state. We work with hundreds of doctors to arrange for convenient care throughout the state. We provide extra level of comfort and peace of mind to patients and their families if they need a second opinion for complex decision making. And together, our cancer teams and your doctors recommend the best treatment options for you. And being part of a network gives you that assurity that you've got lots of eyes and lots of experts looking at your particular cancer and helping you make the best choices to fight your disease.
Now, Nancy, if someone notices, hey, this just doesn't look right, this is a little worrisome to me, what steps should they take?
Great question. We always recommend that you start with your primary care provider. and you list for them the concerns that you're having, and then they're going to order the proper lab work and diagnostic imaging that will show us where we need to go. And in the event that a cancer diagnosis is made, then you're referred to either surgeons or treatment options. But primary care is always your safest and best bet to start if you're very concerned about a possible cancer diagnosis.
So never delay treatment. That is your big message today.
Never delay treatment. And we have a complete list of providers in the area by visiting on McLaren.org. Find a physician if anyone does need help. And we know, or we're learning, that during this pandemic, many people, through loss of job or loss of insurance, haven't been able to do that. And McLaren and Karmanos are here to help.
We love it.
So please don't postpone your care.
Oh, great information today. Thank you so much, Nancy, for joining us this morning.
You're very welcome. Thank you all.
Of course.
Have a good day.
You as well. Thank you. If you want any more information, just head on over to the Aging and Style page. That's at WNEM.com.